Okay. Dr. Michelle Wellman is my guest. She is from Fertility SA. If you've got a question, please feel free to ring in. 8223 0000 is the number. When looking at fertility issues, is it generally an issue with the woman's fertility, or can it be a combination of the both?
Not at all. It's
right.
really pretty much split half
is
and
it?
half.
Right.
Yes. Women can have problems with ovulation, so they're not releasing an egg regularly every month. They can have tubal issues or things like endometriosis. Men, sperm count and sperm quality are really quite a common problem.
Right, okay, that's interesting. How long would a couple be trying for before they would start to identify with the fact that perhaps there are fertility issues?
Look, what we would suggest is if the female partner's under 38, if they've been trying for more than 12 months and haven't had success, and it's time to really start to have a chat to someone.
Yeah.
If they're over 38 and they've been trying for 6 months, that's probably about the time to at least start getting some investigations done, getting a bit of information about what their options are down the track.
Okay, and what would be the first step for a couple in that position? Is it to the local GP?
Yes, definitely to the local GP, who will often be able to do some of the preliminary investigations, pick up whether there's anything obvious, and also give some of the very basic tips about how to maximise fertility.
How important is the general overall health of the couple in falling pregnant?
Look, it's really important. Lifestyle factors, in particular smoking, really does affect eggs, and it does affect sperm quality. Other things like being overweight are also important. But I think the good news there is that really minimal changes, so 5 to 10% weight loss, those small changes can make a really, really big difference when it comes to fertility.
If someone's thinking about getting pregnant or would like to get pregnant, ideally, how many months in advance should they be planning to sort of get themselves, I guess it depends on a case-by-case situation, but to get themselves in optimal condition to fall pregnant?
Look, I think it's, it really matters. Getting older is probably more important than getting fitter when you're at the higher age bracket. But really, probably 3 months beforehand, ideally, for men, because that's the time it takes for sperm to mature. So having a good lifestyle in that 3 months before trying to conceive is really important. For women, it tends to be different. And I think there's a bit of a myth around that they have to stop the pill 12 months before and get it out of the system and things like that. They do need to look at their health a few months in advance and take folic acid supplements at least a month before trying to conceive.
Okay. Dr. Michelle Wellman is my guest. She is from Fertility SA. We're talking all things fertility today. Please feel free to contribute to the segment. 8223 0000 is the number. 1999 1395 if you'd like to send a text message. Perhaps you'd like to share your stories. Fertility may have been an issue for you. We love a success story, so we would love to hear them as well. Talk to us about this new healthy living and fitness program that Fertility SA is running.
Well, we've started a program that runs over 7 to 10 weeks, and really the idea is to provide motivation and support to women who are trying to conceive or undergoing fertility treatment. So it's open to patients of Fertility SA, so they're seen by a doctor, and the program's under medical supervision, and they'll be assessed by a nurse at the beginning and the end, their blood pressure and some general blood tests. And then during the sessions we have a session with our personal trainer Megan, who's fantastic. She's also an embryologist, so she has a really good scientific background about lifestyle and what makes a difference to fertility. And then the other part of the session is about information. So we have goal setting, diet, menu planning. We've got hypnotherapists coming to talk to people. So it's really about giving as many strategies as possible to help them achieve their goals.
I guess this was set up in response to something that you as a team recognised. Do you think that you felt that some of your patients, I don't know, for want of a better term, sort of needed an education or needed advice and a consistent message given to them?
Some of it's education. I think a lot of people know what they need to do. It's really having that motivation and that support, I think, is really important part of the program. It's hard enough to do, for anyone, but when you've got those pressures of fertility and trying to conceive in the background, that can really add to the stress and the pressure.
Yeah, without question. Talk to me about polycystic ovarian syndrome. It's something that we commonly hear about now. Is it quite common?
It is. Up to about 12 to 15% of the population are affected. Higher, about 21% of Indigenous Australians have polycystic ovary syndrome. And basically what it is when a woman doesn't ovulate on a regular basis. There are particular ultrasound features and blood test features that go along with it, but being overweight is one of the things that really does exacerbate the symptoms and prevent ovulation. So that condition in particular, women can lose 5 to 10% of their body weight. Often they'll start to ovulate and have about a 30% chance of pregnancy without doing any more complicated type treatments.
Fantastic. The fact that the women who achieve a weight loss goal of 5 to 10% yields significant clinical improvements in fertility. That's quite a small weight loss, isn't it?
It is.
For significant improvement in fertility.
It is, and we're really not expecting miracles over that 7 to 10 week program. And I think really one of the things to stress is that such small differences, small changes to lifestyle can make really, really big differences when it comes to getting pregnant.
Fantastic. So I guess if people are out there listening, what's your advice to them? Where can they seek out further information if they're worried about their fertility? I guess another question I want to ask before I let you go, though, is if you're a single female who is, but for want of a better term, biological clock is ticking, what options are out there, and are there options just for them just to go and check the state of their fertility?
Look, there are. I guess it's really important before doing something like that to actually think of whether it would change what you do.
Yeah.
Because some of the tests aren't the be-all and end-all and don't often reflect natural fertility. But we can assess a woman's ovarian reserve with an ultrasound and blood test. And that will give an indication of where they are in comparison to the average person in their age group as far as how many eggs they've got left. But it doesn't tell us what's going to happen in 5 or 10 years' time or even 2 or 3 years' time. So it only tells us what's happening now. One of the problems is if we say it's low, it doesn't necessarily mean that they won't be able to get pregnant. And if we say it's really high, then they may get false reassurance, that they'll be able to get pregnant easily.
Yes.
So you do have to be, there are tests available. You do just have to be a bit wary about what you do with that sort of information.
Okay, great. www.fertilitysa.com.au is the website. Obviously, you have to be a patient of Fertility SA before you start the program. So would it be a matter of going to your GP and getting a referral? Is that what's required?
Yes, you need a referral from your GP to see one of the doctors.